My name is Jerry Hesch. I'm a physical therapist and I practice part-time in Henderson, Nevada. Have a rare opportunity here to look through a CAT scan which shows of course, the 12 thoracic vertebrae, T1 through T12, as well as the 12 ribs that join those thoracic segments. And most injuries are low back or neck, and so it's pretty rare to get a opportunity to look at this CAT scan. I am not a trained radiologist. I am not trained to read these or interpret those, and I make no claim. What's fascinating, though, is to look at them and understand a little bit about the structures, and that's what we intend to do. I teach seminars, and I have a distance learning program. I see occasional clients. I work part-time in Henderson, Nevada, and that is my website. This is called the scout film here and here, and they show you the slices throughout the body, and they number them. And this is transverse slices, and each slice is approximately 3.5 millimeters. So we're going to pan across, and these are vertebrae. And in fact, that's a cervical vertebrae. So this scan started in the cervical spine. You can see those little foramina through which the vertebral artery goes. And because you don't see ribs, it can't be a thoracic. Okay? So we've gone through the neck, and then it comes down on the next sheet or so where you start to see ribs. So this is actually a cervical portion. And now you start to see the good stuff, okay? We're still seeing just vertebral bone here. And now you start to see something else on the outside, right there. This is the first rib. And this is the first rib on this side, and this is the first rib on this side. This is the back of the spine, that bump in the middle, and this is the vertebral body, and this is the spinal canal. Okay, and then the neuroforamen would be here where the nerves come out, or the nerve roots rather come out. Okay, so here's the rib again, and you can see that approximately a 45-degree angle for the first rib, and you can see that Mother Nature sometimes makes them a little bit different on each side. This is really nice. Okay, so let's just pan across. And when I see something really different, I will stop. But I think that's it on this side. I think that covers it rather well. Now, one thing you can see, let's go to this one. You can see that the spinous process is pretty long in the T-spine, whereas in the cervical and in the lumbar, they are certainly shorter. So here we are again. This is, clearly a rib there, okay? And this one I like because this structure right here is part of the spinous process, all right? It actually is connected to the vertebrae, but because this is one slice, it's catching the tip of it, okay? This then is the rib, okay? So the rib makes a joint right in there that's not well visualized here, okay? You may see it on a different image. Let's actually go down to the next one. Okay, so you can see part of that rib joint in there. Okay, and then you can see where it hits against the vertebrae. Now in the upper and lower spine, it hits one vertebrae, and you can see a little what's called a demi-facet, where it makes a joint there. It's a movable joint, but it doesn't move a lot. That's actually more of a pivot joint, and the movement happens more on the outside of your rib cage and in the front of your rib cage. This is more like a pivot. Okay. Now here's another nice image. You can see that whole joint. Okay. I had a thought and I lost it. Let's come down to this image. The point I really would like to drive home is how thick the joints are where the rib joins the vertebrae. And I started to tell you that at the top T1 and at the bottom T12, the rib joins one vertebrae. Okay? As you go down the thoracic segment, say down as low as T3, on down to T, say 10 or so, it actually joins two vertebrae right at the disc. So this rib actually abuts the disc and the vertebrae above and the vertebrae below. There's a tremendous amount of soft tissue, connective tissue, ligament, and of course ribs have muscle all the way around them, you know that. And so right next to the rib, on one of these images, we'll show you a facet joint. And the facet joint is easy to manipulate. The upper one is somewhat difficult, the lower one is somewhat difficult. But otherwise, the mid-thoracic spine is pretty easy to manipulate in the facet joint. 1 centimeter away at arbitrarily the third rib. The third thoracic facet is 1 centimeter away from the rib joint. So oftentimes you can have a rib that doesn't move, it's stuck, producing some pain, limiting the ability to manipulate that motion segment. Or you may get manipulation after manipulation after manipulation, but because the rib is controlling it, it readily comes back. So when I treat ribs, I find out which direction they're stuck in. Now we're back to the cervical spine. And I move them over a period of 2 minutes in one direction. I will typically treat them in 2 directions. Sometimes I will treat them in 3 directions. Yesterday I treated a pregnant woman who was in a car wreck, and she had numbness down her arm, and the first rib was stuck inferiorly. I see that, this is cervical. I see that about once, cervical spine, and here we are, this is thoracic. More of the same, okay? And I see an inferior rib about once every 5 years. Now you look at some of these wrestlers, and you look at some of these football players that come and crash down on that elbow, on that shoulder rather, and you can imagine that yes, the rib in fact can go inferiorly, but it does take a tremendous passive force. I think her force was that her pelvis struck against the door and the steering wheel violently turned to the right, and the rest of it I don't know. What I do know is that when we mobilize that rib back up, the numbness went away. She felt like her whole arm was coming back alive. So anyway, it's an important structure, these ribs, especially in the upper neck at the first rib. Now this one, you can see how dense that joint is. This is really nice. If you look at other joints in the spine, they're not that big. Okay, this is a rib joint. Okay, over here, same thing. And over here, you can see the spinous process. Just a little bit of it actually connects out here, but we're at the very top of it. So you're getting just a circle there of bone. If you could go deep into it, another, say, 3/16 1/4 inch, you would then see the connection. I think we'll see that shortly. But so this is rib here, okay? And then this is spinous process. I'm sorry, this is transverse. Transverse. There's another one here. This is spinous process, all right? And then this is vertebral body, and this is spinal canal, all right? So moving along, here you see the facet joints. This is the nicest image I've seen yet on the facet joints. Those are movable joints, okay? Look how close it is to the rib joints. Isn't that incredible? I think that's underappreciated in the clinical science, okay? Here's another image. See how this rib really engages? See the fact that this rib head is concave. And so it's fitting with the convexity of this thoracic vertebrae. And this vertebrae, vertebral body, is rather trefoil shaped, and the opposite shape, I'm sorry, like if, smaller but flipped over, mirror image, is the canal. And here again you see that long rib joint, full of ligament, compared to small facet. Okay? So if we want to move this joint because the rib is not out of place, it's simply stuck in a position of pain or one in which it's a long, long lever, so it's stuck and it's pushing in here and making this joint jam, as an arbitrary example. So it takes a lot of force to get movement in this joint, and please recall, the movement will be in 1 or 2 or 3 directions when you are trying to correct it. So that's the point I want to drive home. And I think the rest of these images pretty much reflect that. So let's move on and pull up the other films. We can probably wrap this up if I... now here's a rib. Notice that as you go further down, the articulation is actually longer. Okay? I could look at the scout and I could look at the number and I could tell you which thoracic segment this is. For the interest of time, I'm not going to do that. But here is your rib. Okay? And now you actually see the spinous process. That's beautiful. That is the spinous process. And we're at a level where you don't see the facet joint now. And here's the spinous process. This is what you feel in the back. Okay? And here's the other rib. There's a joint right there. That's a ligamentous, that's a capsule. That is a synovial joint. And then this is a joint space full of ligament connective tissue. This is a synovial joint, except that it's not a real freely mobile synovial joint. In between, there's a fair amount of fibrous tissue, I believe, or at least a lot of ligament, and it behaves much less like a synovial joint and more like a fibrous joint. Could have made a mistake in that description. I'll go back to the anatomy, but for the moment, I think the general concept is what we're after. So look how much joint space there is there. Actually, the joint, they mate right there. So that's the joint of the transverse process and the rib. And then up here is the joint where the vertebral body connects. And so there's all that space there. Again, full of, some fat, some ligament, blah, blah, blah. Here it takes on a different shape. Look at the difference in this rib, okay? Or this section of that rib. And then 3.5 centimeters later, it changes shape, or else this is the next segment. I don't know which, nice, generous spinal canal. All right, we'll pull up the next one. And I think we have about 2 more, and we are done. So here you can see, this in fact is the, here's another view. It's a frontal image. And as you come down, you go deeper and deeper. This is from the back going forward, if I understand, okay? So now you start to see the second rib, a little bit of the first. Here, you get a clearer image of what I believe is the first rib. So this would be the cervical spine, okay? Yes. So it gets kind of complicated on this film, but again, that is clearly a rib, all right? And then that's your transverse process right there. I don't see anything else that we really need to chat on this side. Okay, so let me pull the other one. And this is the last one. And so this is a sagittal view of the thoracic spine. So they're taking serial slices from the outside going towards the midline progressively. So as you go progressively towards midline, you'll get better sense of the neural foramen, at least at a couple of these, and then these ones are obscured. So then you go to another slice, and now these ones are obscured, hello, and now the lower ones have a better imaging, okay? And then you come here, and now the lower ones image, and now bye-bye. And so on this one, you see a little bit of lipping here, okay? And then you see a little bony segment there on the front of the vertebral bodies. And I would ask you, is that a rib head? Was she positioned a little bit slightly in such that the first rib head shows in this view? I believe that's correct. I believe that is what that is. We read the report, and there was no indication that there was any real pathology there. And when they tell you, as you read about looking at films, I've only read a little bit, but what they say is you can't go on one slice. Ideally, like with an x-ray, you always do 2 that are perpendicular to each other. And they say if you see something that looks suspicious on one slice, but then you go to the next slice before and after, and it's not there, it may be some kind of artifact, but of course the doctors correlate that with the clinical presentation. I'm very fortunate in that I don't practice medicine. I think medicine is a daunting profession. And I'm your B student. I'm not your A student. I'm the one that has to read the chapter 4 times, okay? But I love hands-on work. I love correcting somatic dysfunction and decreasing pain. And so I'm very blessed to have that profession. Thank you very much.